Welcome everyone to Physician Quality Reporting System PQRS and ePrescribing or eRx 2011 update. Our speakers today are Kim Ross, the Academy's Coding Specialist, and me, Sue Visciarelli, the Academy's Coding Executive. To begin with, this webinar is based solely on the information that is new to PQRS and ePrescribing for 2011. All additional information may be found on our website, and that information is included in this presentation. So let's begin with the new name. The Physician Quality Reporting Initiative, PQRI, effective January 1st of 2011, is now known as the Physician Quality Reporting System, PQRS. Electronic prescribing is also known as ePrescribing and eRx. So let's begin with PQRS, formerly known as PQRI. And I know that's confusing because some of our web links or email address still use PQRI just as a convenience. Successful participants will receive in the fall of 2012 1% of their Medicare Part B allowable rather than the historical 2%. This does not include, of course, the injectable drugs or durable medical equipment. Registry reporting will require 80% for successful reporting. On the other hand, claims-based reporting is now 50% rather than 80% of successful reporting. Our statistics show that the majority of ophthalmologists who have been participating in PQRI who did not receive a bonus, for example, would receive 92% on one measure, 89% on another measure, and 78% on the third measure, so they didn't receive a bonus. And now with this new reporting being 50% success, those ophthalmologists will be receiving a bonus if they continue to report successfully. Measure 139, Cataract Comprehensive Preoperative Assessment for Cataract Surgery with Intraocular Lens Placement, has been eliminated because it was not endorsed by the National Quality Forum. Ophthalmologists for 2011 also may report on Measure 130, Documentation of Current Medications in the Medical Record, or Measure 226, Preventative Care and Screening, Tobacco Use, Screening, Cessation, Intervention. To go into the details about this, measure number 130, as I mentioned, is the documentation of current medications in the medical record. The Category 2 code, or the measure code, or the PQRS code, all mean the same thing. There are three options: G8427, list of current medications with name, dosages, frequency, and route documented, or 68430, provider documentation that the patient isn't eligible for medication assessment, or G8428, current medications with name, dosages, frequency, their route not documented, reason not specified. All of the corresponding exam codes are listed under denominator, and you will notice that they include the I codes. Now, there are no qualifying diagnosis codes associated with this measure, so it is appropriate if your system, your own computer system, requires a diagnosis to use the diagnosis that you're already using on your exam. For Measure 226, Preventative Care and Screening, and basically this is to teach your patients to stop smoking. There are two Category 2 codes, 4004F, patient screened for tobacco use and receive tobacco counseling to stop smoking if they are identified as a tobacco user, or 1036F if the patient is screened for tobacco use and has identified his or herself as a non-user of tobacco. If you'll look at the linked exam codes or the denominator codes, again, this year they include the I codes. So ophthalmologists may use those as well as the E&M codes. And again, no diagnoses are recorded for this measure, but if your system will not let you transmit the measure, then you can link the diagnosis that you're using with the exam. Both of these new measures may be reported via claims or via a registry. What's the reporting time frame for 2011? There are two reporting periods, January 1st of 2011 to December 31st of 2011 for the bonus based on 12 months of claims, or July 1st, 2011 to December 31st, 2011 for 1% of your allowables for 6 months. There are two ways to report. Claims, the measures are reported in real time in your office. One of the problems with claims is that if a measure was left off, remember historically you've only had a 20% error rate. Now you have a 50% error rate. The second option is the CMS approved registry. Many of our members currently are using a registry, and they're more successful with a registry when they haven't been successful with claims reporting historically. The measures are reported to the registry. CMS needs to make sure that this is an approved registry, and if you use the registry must receive the data by January 31st of 2012, so it gives you additional time to get your measures supported. So they are not reported in real time as they are with claims. Now there's a comparison of claims versus registry reporting on our website, and it goes through a long list of Q&A, and it also gives the information about the registry that the American Academy of Ophthalmology is partnering with. All measures about, all the detail measures about everything you need to know about PQRS can be found at www.aao.org/PQRI. Particularly here are the 2011 changes identified, the measure specific. And if you will follow this step by step, and we even have examples of the CMS 1500 forms, you should be successful, very successful with your PQRS reporting. Questions following, of course, this webinar may be emailed to PQRI@aao.org. And again, we've left the PQRI just due to familiarity. So Kim, I'll turn the time over to you to talk about e-prescribing.
Thank you, Sue. We'll continue the presentation with e-prescribing, either with standalone systems or with your EMR system. For 2011, the e-prescribing Category 2 code, or G code, is G8553. This is not a change. It's the same code that you're going to report or did report in 2010. At least one prescription created during the encounter was generated and transmitted electronically using a qualifying e-prescribing system. E-prescribing is also reportable via claims or registry for 2011. What constitutes a qualifying system? To be considered as a qualifying e-prescribing system, the system has to be capable of all of the following. It needs to be able to generate a complete active medication list incorporating electronic data received from applicable pharmacies and pharmacy benefit managers if available. It must be able to select medications, print prescriptions, electronically transmit prescriptions, and conduct all alerts. It should be able to provide information related to lower costs, therapeutically appropriate alternatives if there are any, and provide information on formulary or tiered formula medications, patient eligibility, and authorization requirements received electronically from the patient's drug plan if they are available. The e-prescribing bonus is also based on allowed charges, similar to exactly like PQRS. So it doesn't include your DME or drug charges, but it is on all of your other approved charges for Medicare. For 2011, the incentive bonus is 1%, and for 2013, it will be reduced to 0.5%. Beginning in 2012, there will be a 1% penalty withhold, and in 2013, there'll be a 1.5% penalty withhold based on your e-prescribing participation in 2011. Eligible professionals who are not successful electronic prescribers in 2011 and who do not get one of the following exemptions will be subject to the penalty withholds from Medicare. If you are eligible for a hardship and it applies to you, you must submit an application of the payment adjustment application for hardships through CMS. If you are approved as a hardship, you would be using one of the three following codes when submitting to CMS to avoid the penalties in 2012 and 2013. The first code is G8642, and this is the eligible professionals who practice in a rural area and don't have sufficient high-speed internet access. The second code is G8643, and this is for the eligible professional practices in an area without sufficient available pharmacies for electronic prescribing. The other option would be for those eligible professionals who do not have prescribing privileges. Those physicians would report G8644 via claims, not via registry, and if this code is utilized, the eligible professional may not be considered for the payment adjustment in the subsequent years. Physicians have to report the measure 25 times, similar to that for 2010. This also includes your E&M and I-code visits during the 12-month reporting period from January 1st through December 31st. There's only one reporting period. However, your 2012 payment adjustment will be based on the reporting period from January 1st through June 30th of 2011. So you must report a minimum of 10 electronic prescriptions during the first 6 months of 2011 to avoid the penalty withhold of 1% in 2012. The Academy has an e-prescribing web page, which can be found at www.aao.org/e-rx in lowercase. Any additional questions that we may not have addressed in the Q&A section of our PQRI webpage or our e-prescribing webpage may be emailed to pqri@aao.org. I want to thank you for your participation in this update for PQRS and e-prescribing.